Hey everyone, it's Dr. Sandra Lee, but you know me as Dr. Pimple Popper. While I usually deal with, well, pimples and other skin conditions, today we're diving deep into a different area of the body, the pelvic floor. We're going to be talking about vaginal prolapse, a condition that occurs when the pelvic organs like your bladder, uterus, or rectum start to drop down into or even out of the vagina. This happens when the muscles and tissues supporting these organs weaken. Now don't worry, we're going to break down the different types of prolapse, their causes, symptoms, and what you can do about them. So, let's get started. Alright, let's jump right in with cystocele, also known as a bladder prolapse. This condition can be quite uncomfortable and even distressing for many women, but understanding it is the first step towards managing it effectively. Imagine your pelvic floor like a hammock that holds your bladder, uterus, and rectum in place. This hammock is made up of muscles and tissues that provide crucial support to these organs. Now, if that hammock gets weak or stretched out, things can start to sag. This weakening can happen for a variety of reasons, and when it does, the organs it supports can shift out of their normal positions. In a cystocele, it's the bladder that's doing the dipping. Essentially, the bladder starts to bulge into the vaginal space, which can lead to a range of symptoms and complications. This happens when the front wall of the vagina, the part closest to your bladder, weakens. This wall is supposed to act as a barrier, keeping the bladder in its proper place. Think of it like a weak spot in the hammock. When this spot gives way, the bladder can start to push through, creating a bulge. As the support weakens, the bladder can bulge into the vagina. This bulging can cause discomfort and a feeling of heaviness or pressure in the pelvic area. Now, you might be wondering what causes this weakening. There are several factors that can contribute to the weakening of the pelvic floor muscles. Well, childbirth is a big one. The process of giving birth can put a tremendous amount of stress on the pelvic floor muscles, especially during a vaginal delivery. Pregnancy and vaginal delivery can really put a strain on those pelvic floor muscles. The weight of the baby and the act of pushing during delivery can stretch and weaken these muscles. Age is another factor. Just like other muscles in our body, the pelvic floor muscles can weaken over time. As we age, the tissues lose their elasticity and strength. And then there are things like chronic coughing, constipation, or even heavy lifting that can put extra pressure on these muscles. Repeated strain from these activities can gradually weaken the pelvic floor. Now, when it comes to symptoms, some women don't experience any at all, especially in the early stages. This can make it difficult to detect the condition early on. But as the prolapse progresses, you might start to feel a sense of pressure or fullness in your vagina. This sensation can become more noticeable over time. It can feel like something is pushing down, especially when you're standing for long periods or straining. This can be quite uncomfortable and can interfere with daily activities. You might also have trouble emptying your bladder completely, leading to those annoying urinary tract infections. Incomplete emptying can cause urine to stagnate, creating a breeding ground for bacteria. Moving on to rectocele, which is a prolapse of the rectum. This condition can be quite distressing and uncomfortable for those who experience it. In this case, it's the back wall of the vagina, the part closest to your rectum, that weakens. This weakening can lead to a variety of symptoms and complications. Think of it like the back of the hammock giving way. When the support structure fails, it can no longer hold everything in place. This allows the rectum to bulge into the vagina, creating a noticeable and often uncomfortable protrusion. Just like with cystocele, childbirth, aging, and chronic straining can all contribute to rectocele. These factors weaken the pelvic floor muscles over time. Now, when it comes to symptoms, you might experience difficulty having a bowel movement. This can be frustrating and can significantly impact your daily life. It's like trying to squeeze something out of a tube that's been pinched. The passage is obstructed, making it hard to pass stool. You might feel the need to strain a lot, and even then, you might not feel like you've completely emptied your bowels. This can lead to a sense of incomplete evacuation. Some women even need to use their fingers to press on the back wall of their vagina to help push the stool out. Talk about uncomfortable. This manual assistance is often necessary to alleviate the blockage. And just like with cystocele, rectoceles are also graded based on the severity of the prolapse. The grading helps determine the appropriate treatment and management options. Let's talk about uterine prolapse, where the uterus itself starts to descend into the vagina. This condition can be quite distressing and uncomfortable for many women. This happens when the ligaments and muscles that normally hold the uterus in place become weak or stretched. These structures are crucial for maintaining the proper position of the uterus within the pelvic cavity. Again, childbirth, aging, and increased pressure in the abdomen from things like obesity or chronic coughing can all play a role. Each of these factors can contribute to the weakening of the pelvic floor muscles over time. Now, imagine the uterus like a pear hanging from a tree. The stem represents the ligaments and muscles holding it up. When these supports weaken, the pear starts to drop. In a mild prolapse, the uterus might just dip a little lower in the vagina. This can cause some discomfort but is often manageable with lifestyle changes and exercises. But in more severe cases, the cervix, which is the lower part of the uterus, can actually protrude out of the vagina. This can be quite alarming and may require medical intervention. Talk about a plot twist. The severity of the prolapse can vary greatly from one woman to another. Symptoms of uterine prolapse can vary, but many women experience a feeling of pressure or fullness in the pelvis. This sensation can be persistent and bothersome. It can feel like you're sitting on a small ball. This unusual sensation is often one of the first signs that something is not quite right. You might also have lower back pain, pain during intercourse, or even bleeding from the vagina. These symptoms can significantly impact a woman's quality of life and should not be ignored. Now this one's a bit unique: vaginal vault prolapse. This type of prolapse can happen after a hysterectomy, which is the surgical removal of the uterus. Remember how we talked about the uterus being like a pear hanging from a tree? Well, after a hysterectomy, the top of the vagina, which used to hold the cervix, can sometimes weaken and drop down. It's like the tree branch itself starting to sag. This can happen if the ligaments and tissues that support the vaginal vault aren't properly reattached or if they weaken over time. Symptoms of vaginal vault prolapse are similar to other types of prolapse: pressure, fullness, discomfort, and even problems with bladder or bowel control. Let's talk about enterocele, which is when the small intestine decides to join the prolapse party. In this case, a portion of the small intestine bulges into the space between the vagina and the rectum. It's like the small intestine is trying to sneak out through a back door. Enterocele often occurs along with other types of prolapse, especially uterine prolapse. The same factors that weaken the pelvic floor muscles and ligaments can contribute to enterocele. Symptoms can include a feeling of pressure in the pelvis, discomfort when standing for long periods, and sometimes even constipation. And finally, we have combined prolapse, which is when more than one organ decides to prolapse at the same time. It's like a team effort, but not the good kind. For example, you could have both a cystocele and a rectocele, or a uterine prolapse with an enterocele. The causes and symptoms of combined prolapse depend on which organs are involved and the severity of each prolapse. It can be a bit more complex to manage, but there are definitely treatment options available. So, there you have it, a closer look at the different types of vaginal prolapse. Remember, this condition is more common than you might think, and it's nothing to be ashamed of. The important thing is to understand the different types, recognize the symptoms, and seek help if you need it. Early diagnosis and treatment can make a world of difference in managing symptoms and improving your quality of life. If you're experiencing any of the symptoms we've talked about, don't hesitate to reach out to your doctor. They can help determine the best course of treatment for you.